Okay, so over 2.7 million African Americans currently have asthma and are 3 times more likely to die from asthma-related causes. Here to discuss how to manage severe asthma and the importance of representation in clinical research are pharmacist Reema Dirks and Business Performance Director of the Representation of Clinical Research Team at Amgen's Chrissy Carter. Come on up, ladies.
Hello, everyone. It's truly an honor to be here with you today. The energy in the room has been so inspiring, especially after that last presentation. I'm learning so much from the great speakers and from all of your really great questions. I am Chrissy Carter. I'm a Business Performance Director at Amgen on the Representation and Clinical Research Team, also known as RISE. At Amgen, we are committed to health equity for Black and African American communities, and we're excited to connect with other leading organizations and individuals here today with the same commitment. The Black community is 30% more likely to die from heart disease than non-Hispanic whites. They also bear a disproportionate share of the cancer burden, having the highest death rate and the lowest survival rate of any racial or ethnic group in the United States for most cancers, and suffer disproportionately from severe asthma, as you just heard, which my colleague Reema will talk about in just a minute. So I'm going to share a little bit about Amgen, our commitment to patients, and specifically what we're doing to advance health equity. This topic is near and dear to my heart, as my husband, who's in the audience, is Black and comes from a family background where many of his relatives have been affected by these issues. I also have 2 biracial children, so I'm just truly humbled to be a part of this movement and to share this experience with you today. Amgen is one of the world's leading biotechnology companies, and our mission is to serve patients. We aim to discover, develop, and deliver life-changing medicines for patients everywhere, and to transform how patients, physicians, caregivers, and societies around the world fight serious illnesses across 6 core therapeutic areas. We're deeply rooted in science, and we are working to find new solutions to meet the growing demand for better quality healthcare for more people worldwide. There are significant opportunities to improve the health of all people through understanding and addressing health disparities in specific communities. Our commitment to patients, science, and innovation motivates us to work to remove the barriers that limit equitable access to high-quality medicine and healthcare. These barriers are present around the world, but vary significantly by geography and community, and they tend to be particularly impactful in the Black and African American communities, as you've heard today. Making a positive difference in the world is at the heart of what we do at Amgen, and it goes beyond making vital medicines. We're working to help build a better world by focusing on environmental, social, and governance topics that matter most across 4 pillars: healthy people, healthy society, a healthy planet, and a healthy Amgen. We are taking concrete steps to make a measurable impact across these pillars, as we believe, like I said, that health is truly equitable when everyone everywhere has the opportunity to be as healthy as possible. While bringing innovative medicines to people suffering from serious diseases is one of the best ways we can contribute to the greater good, we know that society confronts multiple challenges, and we are working to do our part to address them so that more people can experience the benefits of science. Clinical trials are a critical part of developing a new medicine. Patients who volunteer to participate make a vital contribution to research and generate valuable information. But as you've heard today, clinical trials have lacked patient diversity and representation for decades, an issue that has been recognized long before the pandemic. Unfortunately, when some groups are underrepresented in clinical trials for new medicines, there is a risk of collecting insufficient data to assess their effectiveness or safety in those populations. Racial and/or ethnic backgrounds in combination with other independent factors, including social determinants and genetics, contribute to differences in drug exposure and a response to the access to those medicines. Clinical research is a viable option that presents benefits to patients, physicians, and the broader research community. Equitable access to these clinical trials is essential to achieving health equity. But we must remember that clinical trial participants are volunteers, and their decision to volunteer themselves to be part of clinical research is absolutely critical and requires trust, which we've talked about quite a bit today. This is why education and learning about health and building trust within the community is imperative. So while the push for more diversity and inclusion in clinical trials is not new to Amgen, we did accelerate our efforts in 2020 with the formation of RISE, which stands for Representation in Clinical Research. We're a team dedicated to addressing the systemic issues that deter people from participating in research, especially those who have been historically excluded due to race, ethnicity, sex, age, or other factors. RISE is a dedicated team of experts in clinical trial design, operations, health disparities, who are focused solely on this work. Our mission aligns with Amgen's mission to serve patients with a special focus on diversity and representation. We strive not only to improve diversity and representation at an organizational level, but also across the dialogue across the industry. So RISE is committed to addressing the barriers and mistrust that we've been discussing in the room today. And our plan to do that is built on 6 key elements. Evolve the way that we design and run clinical trials, partner with the healthcare providers who share similar backgrounds and languages with the patients we wish to work with, bringing research to where people live, work, play, pray, meeting the communities where they're at, changing how researchers communicate with patients, caregivers, and providers, enhancing precision medicine and biomarker screening and awareness, and last but not least, collaboration with national and community organizations, which is what we're doing here today. At Amgen, we know there is work to do. We will continue to evolve our approach as we hear from the community, particularly through forums like this, where we can hear directly from all of you. Some of you have already stopped by our booth and shared some really key insights with us that I'll take back to the organization. Listening, talking, and actively educating in communities where trial participants live are important steps in a long road. Change will only occur if there is a collective willingness to learn, commit, and to take action. So with that, thank you for the opportunity for Amgen to be here with you today to share how we are working to expand the reach of better health outcomes that everyone deserves. Please come see me at the booth and let's talk about ways we can partner with you and your community. And I look forward to seeing the next steps that stem from bringing us all together here today. So have a wonderful rest of the day, and I hope you enjoy our presentation on learning and understanding about asthma.
Good afternoon, everyone. My name is Reema Dirks, and I'm a pharmacist. I'm here to talk to you today about asthma, but before we get started, I want to give a big thank you to my employer Amgen, Chrissy's team RISE, and Black Health Matter for the very, very important work that they're doing within the Black community to better health. So when I present this information, typically to an audience like this, I like to begin with the why. So why are we here? Why should you pay attention? And, unfortunately for this beautiful audience, the answer was really easy. According to the Allergy and Asthma Foundation of America, compared to white Americans, if you are a Black American, you are 1.5 times more likely to have asthma. You're 5 times more likely to visit the ER due to your asthma. You are 3 times more likely to die from asthma. And when sex is factored in, Black women have the highest rates of death due to asthma. And we could talk about the disparities all day long. We've talked about it today. The reasons are very complex, social, biological determinants are responsible. But as Dr. Nyane said at the beginning of this morning, he said the structural determinants of health are really important. And living in Oakland, I see the signs of this every day within my community and my neighbors, and it's very sad. I've also talked to many of you today, and you've shared with me about stories about how your doctor doesn't want to seem to diagnose you with asthma. It's telling you to lose weight or get some more exercise. Being dismissed, sadly, is a very real thing, and you know that all too well. Now, my point is not to scare you, but to help you really understand that this is a disease that so many people die from year after year that don't need to die. No one, and let me be very clear on this, no one in this day and age should be dying from asthma. So that's why we're here, to take back that power, to take charge. It's been the theme of the day, right? To change the narrative, to empower ourselves. We've heard that word today so many times. Empower ourselves with the knowledge and really be the best advocate we can be for ourselves and our asthma community. And as Dr. Wendy said earlier, be as bold as we can be when it comes to taking charge of our health. So today, my goal is to help you learn, understand, and manage your asthma so that you can have a productive conversation with your healthcare provider. So with that, we'll begin. This is LUMA, Learn to Understand and Manage Asthma. Usually I do this virtually, so just disregard all the bullets, except for the last one. And I mentioned I'm a pharmacist, so it goes against my DNA to not give you personalized medical advice because I want to do that, but unfortunately in this format I cannot. So we'll start with the airway. So asthma is a chronic disease of airway inflammation. So chronic meaning this is a disease that lasts a really long time, can be lifelong, and asthma is a disease of inflammation in your small and medium-sized airways that can lead to making it really hard to breathe. So on the far left, you can see there's a airway depiction of a person without asthma. In the center, a person who has asthma, and on the far right, you'll see a depiction of an airway of a person who is having an asthma attack. So we'll start on the far left in a person who does not have asthma. So you can see the airway is nice and open. Those dark pink muscle bands are nice and relaxed. The air can flow in and out really nice and easy. There's a thin layer of mucus depicted in the yellow, so that usually will trap particles and get them out of the body immediately in a person who does not have asthma. In the center, we've got somebody who has asthma, and you can already see a difference. That space where air is going in and out is much more narrowed, right? You can see the airway looks different, it's thicker, the muscle bands are a little tighter. The mucus lining the airway is a little thicker as well. Then you have on the very far right, the depiction of an airway of someone who has asthma. The muscle bands, those pink bands around the airway are really tight. The mucus layer is really thick, and you can see that inner layer makes it really, really hard to breathe. Now, if you or someone you know has asthma, and they've talked about having an asthma attack, is like breathing through a straw. Have you guys ever heard that before? It is very scary, and I would suggest if you yourself have asthma or someone in your family who's maybe not believing how severe it can be, have them breathe through a straw, because it is a very, very scary thing. Some of the hallmark symptoms of asthma are coughing, chest tightness, shortness of breath, and wheezing, and I see some of you nodding your heads. Individuals with asthma have a very unique symptom. So that means you might have very different symptoms than, say, your neighbor with asthma. Another person in your family, and you both have asthma, you'll experience different symptoms. Also, asthma symptoms can change over time. So if you had asthma when you were little, you might not have the same symptoms or even triggers, and we'll talk about triggers in a couple of slides, that you do when you are an adult. So how do you get the diagnosis of asthma? Well, we talked about the dismissive tone that you may get from your physician, but these are some of the diagnoses or tests that your physician will do to help give you that diagnosis. So medical history, so the component is genetic, right? So we also want to know if there's asthma within your family. Physical exam, might do blood tests, pulmonary function tests, all to get a better picture of what your lungs look like. So just like ice cream, there are many different flavors of asthma, and severe and uncontrolled asthma are just two of those flavors. So usually the more severe your asthma is, the more drugs you will need to have, so the more medications you'll need to have. Severe uncontrolled asthma is when you have those symptoms of asthma, even though you are on all the medications your doctor tells you, you're taking them as prescribed, you're avoiding your triggers, all of those things. And how do you know? How do you know if you have uncontrolled asthma? Well, we call it the rule of twos. So this is something, if you're taking notes, is probably important to know. So if you have uncontrolled asthma, you will experience daytime symptoms more than twice a week, nighttime waking due to asthma more than twice a month, use of your asthma reliever more than twice per week. So again, the rule of two. So if you experience any of those, it's important to take note. We'll talk about an asthma journal in a few minutes. Take those, note those down, and provide those to your physician. So you're not alone. You already heard some statistics about asthma. 25 million people in the US have asthma. About 5 to 10% of them have severe asthma. And about half of those, so 1.25 million people, have severe uncontrolled asthma. So they are living with these symptoms day after day. So we're going to talk about how the immune system is the underlying cause of asthma, but before I get into that, I really want to talk about triggers. So asthma patients have different irritants and triggers that change over time. So you can see in this wheel, I'm going to start with the dark blue side, so pollution. So we live in an urban environment. I live in Oakland. There are lots of freeways, lots of diesel trucks. What the diesel trucks emit can cause pollution. It can also be a trigger for someone's asthma. We live in California. We've got wildfire season. To be aware of that, because that can be a trigger of someone's asthma. You've got allergens, the usual suspects, right? You've got your pollen, your pet dander, cockroaches. So we just came off the heels of a really important week in September for people with asthma. It's called Peak Week. The third week in September, and I always like to think of the Earth, Wind, and Fire song. You will always remember that, take away that from here. The 21st of September, just remember, peak week, very dangerous for all people who have asthma because it is the peak time of pollen for ragweed. One ragweed plant can emit up to 1 billion pollen particles. Can you imagine what that feels like for someone who's allergic to ragweed? Also, it's the time when kids go back to school. A lot of kids have asthma. We need to be really aware with bacteria and viruses. And it really is, peak week is the perfect storm of all of those things. And it is also the height of our ER and urgent care visits for people with asthma. When we think about maybe things you wouldn't think about that would be a trigger, heightened states of emotion, so laughing, crying, stress. I've done all of those so much through the pandemic. It's been very stressful. Exercise. Important to get exercise. We've elucidated that today too. Is this better? Oh, okay. Important to get exercise. Work with your physician, work with your healthcare team to figure out what the appropriate amount is and what the appropriate exercise for you is. Again, in California, we've got wonderful climate, but say you want to go to the mountains and experience some snow. You drive up there, you take that first cold air inhalation, that can trigger an asthma attack. So in people with asthma, these irritants and triggers can activate the immune system in a very different way. So a healthy immune system, you may not even know if you don't have asthma. You might not know if you're fighting off a cold or a virus. Your body just deals with it and you really don't feel the effects of it. People without asthma usually have normal exposures to triggers too. So if you're allergic to oak and you and your friend maybe go on a hike where there are a lot of oak trees, your friend who doesn't have asthma won't experience anything. You, on the other hand, will probably have an asthma attack. So your immune system is the key. In people with asthma, their immune system might respond too much to something, respond to something it should not respond to, or have some sort of unusual response. And how that happens is we inhale these triggers. We inhale the pollen, the pollutants, the bacteria and the viruses, and that comes into contact with that pink line that you see there. That's the surface of your lung. And that's called the epithelium. Now that's going to activate a whole bunch of different immune cells. And with those immune cells, you're going to get all the different characteristics, all the ones that we talked about at the beginning of this talk, the coughing, the chest tightness, wheezing, shortness of breath. And unfortunately, that can lead to asthma attacks and hospitalizations. So now we get to the important meat of the presentation. Really, how can you yourself manage your asthma? So hopefully, if you or someone in your family has asthma, you've heard of an asthma action plan. Can I have a raise of hands? Has anyone ever heard of an asthma action plan? Okay, great, that's wonderful. If you have not, make sure next time you see your provider that you ask for this. It is within the duties of our healthcare providers to provide this for you with writing on what you should take when you are doing well, when you're exposed to your trigger, and then also in an emergency situation, what drugs you need to take, who you need to notify, all of that. And a written asthma action plan should be kept at the school if it's a child, maybe in your place of work, tape it up on your fridge, have it handy. The other pieces are lifestyle changes, the three that you see there, lifestyle changes, medications, and asthma journal. And once again, work with your asthma specialist. work with your entire healthcare team, especially when it comes to the medications. I'm a pharmacist. My sister over there who presented earlier today, she's a pharmacist too. Use us. We are your last line of defense sometimes when it comes to, using I've got inhaler, all these spacers and things here. We know how to do that very well. Sometimes the physicians don't have the time, truly. So your home really can be your sanctuary. As we know, the external environment is so unpredictable. We don't know when the wildfires are going on. We don't know what the state of pollution is. Although there is a really handy, when I was doing some research for today, really handy website called LA Breathe. I'll have to correct myself, I might be wrong on that. But it will send you text messages, depending on where you live in LA County, if it's a good day to be outside and exercise, or maybe it's like kind of a yellow day where you might need to wear your mask outside. So you can use these types of resources as well, but your home truly can be your sanctuary. Around your home, get your family involved, have kids, grandkids, friends help you vacuum, wash your sheets in hot water, use allergen bedding covers. There are organizations that provide those for free. I know we love our pets. They do great things for us in terms of lowering our blood pressure, but we do need to make sure that we limit our pets in the bedroom. And then on the right-hand side, I'm not going to belabor any of those points there except for one. You can probably guess which one I'm going to say. Please try to avoid tobacco smoke. 1 in 5 people who have asthma continue to smoke. It is the best thing you can do for not only your lung health, your heart health, for your family, to quit smoking. It takes an average of 5 times for someone to quit. If you want to come see me at the booth, I have resources. You can do it. And it's probably, like I said, one of the best things you can do for your health. An asthma journal can be on an app. It can be a notebook. But things to track for your healthcare provider when you go in and do see them. This is a peak flow meter. I don't know if you guys have seen this before. You breathe into it. It gives you an idea of how your lungs are doing for that day. It's a number that you can write down and track. If you have an asthma exacerbation or a flare-up, make sure you write down what the symptoms are, the severity, all of that. If you have, rescue inhaler use. You guys remember the rule of 2s? So if you're using your rescue inhaler more than twice a week, you got it. A+. Good job. Also, trouble sleeping because of asthma. Sometimes when you wake up in the middle of the night and you cough, or you're just tired in the morning and you're not sure why, sometimes that's not sleep apnea. Sometimes it is actually asthma. So get that checked out. Now, I know I'm running short on time, but I wanted to just quickly go over this. These are some allergy medicines that you may or may not take. You've got your allergy medicines, your biologics, oral steroids, and I want to focus on your long-acting controller and your short-acting rescue. So your long-acting controller can be a pill form or it can be an inhaled steroid, and we're not talking about the steroids you use at the gym to get bulked up. These are just steroids to help reduce inflammation in your airway. So that I liken to if you brush your teeth to prevent cavities, you're going to take your long-acting controller to prevent an asthma attack. One thing I like to tell people who have asthma is rubber band your long-acting controller, whatever medicine you're taking daily for asthma, rubber band it to your toothpaste. So you remember to take it every day. Your short-acting rescue should look like this. You probably have a spacer to go with it. Hopefully you do, because they're prescribed together. This does exactly what it's supposed to do. It's going to rescue you from going to the hospital. It's bulky. It doesn't fit into your pockets. It doesn't fit into a cute little purse, but you have to have this everywhere you go. Take it, really. It could save your life. Spacer, yes. And there are organizations too, and that will provide these if you don't have them, but typically you get those prescribed for you. So again, communicate with your healthcare provider. We talked about that. Keep your asthma journal. Keep all that data that you can provide to your healthcare provider so you can be a better advocate for yourself and you can get a better plan for your asthma. And again, seek care immediately if you're having an asthma attack. We've had far too many people that just say, oh, it's not a big deal. Maybe they don't know what to do. Maybe they're freaking out over it. But really be helpful and tell them to seek care immediately. So hopefully you have a little more tools to really empower yourself and take back that power that asthma has over your life. Like I said, I talked to so many of you today that know somebody in your family that has asthma. We can take that power back and be a better advocate for ourselves in our community. Here's some additional asthma resources: lung.org, American Lung Association, Asthma and Allergy Network. There's a downloadable brochure on that QR code. I also have some cards that have that QR code as well. And I want to say thank you, and not just thank you for listening, but thank you for being here and increasing your education for your health. Thank you.